in advanced implantology, and later to Dr. Sasha Giovanni's office for his periodontology preceptorship as well. After he returned, he worked and continued to work in the Showa University and the OMS department. After that, he left and started his own clinic at Yamanaka Dental Clinic, and is currently the director of it. He's also the chief director of Look Smile Medical Corporation. Is Dr. Yamanaka ready? Yeah. Thank you.
Okay. It would be a last session. I know everybody is tired, but after my presentation, we have a big party. So maybe we can drink more together. So anyway, I really appreciate it to bio staff, especially Brett, and also thank you very much for giving me a good opportunity, having such a good symposium to BIS. And so let me start my presentation. These are my workers working together. So now we are doing presentation. That time they work in Tokyo at our clinic. So I also really appreciate to my staff. And so we're gonna start it. So in the 80s, implantology, especially Professor Ron Mount, started to do the implant in the mouse more than 70 years ago. But in the 80s, more like a functional driven, just implant, placing the implant into the jaw, and we're gonna make a crown and just chew on it. But in 90s, more like a prosthetic driven, we make a surgical stent, crowns. Then we need to place implant on an ideal position. And nowadays, 2000, we think not only function, but also biologic, means we need soft tissue as well. And also aesthetic-wise, we have to make it, beautiful. And nowadays, a few years before, we started to use digital dentistry like Dr. Fauci mentioned. So digital dentistry is nowadays pretty useful to use evaluation, making treatment plan. This is like a facial scan, and we do the facial transfer using a computer. So we can make a good occlusal plane and evaluation, and make a digital wax up on the computer, and we can free explanation to patient using digital dentistry. And also we can make a stent, and we can make a implant on ideal position. See like this? Face ball using a virtual articulator, and we can see the facial position. Of course, aesthetically it's good. We can see the connection with teeth and the lip line, and also nose and the eyes and everything. So we're gonna discuss more later about the digital dentistry at room 1 and 2 after finishing this presentation. So implant therapy in my clinic, my clinic is like a center of Tokyo, little bit outside, so countryside a little bit. So a lot of indigenous cases come into my clinic. So that time I use dental implant to get the stable. And on the other hand, sometimes patient needs aesthetic, like this patient. So multiple case, obviously this case we need bone and the soft tissue. So we need to place implant on ideal position. So let's see this case. So she's pretty old, 82 years old already, and her hobby is going to karaoke to sing a song, and always, denture does not fit well. So she came to me, and I said, why don't you place implants to just get the stable on the dentures? And we saw the CT scan. The front area almost no bone horizontally. So I was thinking, I don't want to place implant on the front to such an old women. So that's why I said, okay, let's place implant and get the stable on the dentures. Slide is strange. So I decided to place implant here, right side and the left side. And the right side, the back one, I did it a little bit socket lift. And regularly placing implant, 4 implants, and the left side, a little bit with the bone horizontally. So I placed implant with a GBR procedure horizontally at the same time. And then we use the locator system, and we got a good indication to get the stable of the dentures. So patient is very happy, and less indication, not too much trauma. So already 5 years of follow-up, but she's really happy. In the left side patient, he's a school teacher, high school teacher, and always front teeth come up. So he always, all the time when he gets something like loose, then he buys some bond at the store and he put it back for himself. But he decided to fix on the front. So this is actually final restorations. I didn't place so many implants for multiple case. I placed 3 implants with 5 unit bleach, but a lot of detail, so we will see. So first, we of course need to remove the teeth, but the canine tooth still root was clean. So I decided to do the teeth extraction with simultaneously placing implant at the same time, because the buccal plate was a little bit impacted. And after tooth extraction, soft tissue will heal. So we waited 2 months. At that same time, we evaluate the occlusion using temporary dentures. So we make a stand before we do the surgery, and the 3 implants were placed. See here, the canine tooth is here, but the ideal position is here. And we grafted because the implant surface was exposed. This is kind of horizontal bone augmentation. And to put the membrane on it. And I use the stent on the second surgery. So this kind of a multiple case, it's easy to find the implant where we placed. So for example, one implant placement is easy to find where we placed, but the multiple case sometimes hard. So I use the stent when I use it for first surgery. And then we try the metal and metal frame trying. And again, we send it to general lab technician. And then, this is a very traditional way, PFM screw retain. Here, 3 implants, ovate pontic on the front tooth. We make a good shape emergence profile using a temporary prosthesis. And now, the CT scan, the buccal plate, especially canine area is good. A little bit thin, but already 6 years of follow-up now. Very stable. So this is the key of the success implant treatment. For me, we obviously need a positive bone volume, which is hard tissue. And also need good biotype, which is soft tissue. Need the thickness of the soft tissue. And also, the most important thing is implant position. Now there's a lot of implant companies here. I mean, there, all over the world. But important thing is implant position. And also, abutment design is really important to get a stable soft tissue, hard tissue, and crown. And the best things would be to make a crown would be find good dental technician. So these are more. These are more surgical work. The bottom one is more like a prosthetic work, but we work all together. I do for myself everything except dental technician. So let's see the front case. These 3 cases are all different patients. The left side and in the middle, Jason tooth is crown. So this kind of indication to place an implant is much more I can relax, because sometimes I can remove the crown so we can recreate the emergence profile. But this kind of cases, Jason tooth is natural tooth. So sometimes I feel very uncomfortable to place an implant this kind of a patient, or natural tooth, but only one tooth missing, or broken teeth, and then she required to place an implant, will be very nervous. My laser pointer. Sorry. And this patient, actually, she is my wife. And I have 4 kids. And the kids sleep. After sleeping, we open the bottle of wine with good sashimi. And that time she was eating abalone sashimi. Then maybe she bites on the front. She has ouch. And I saw that. I saw the lateral incisor on the left side. So unfortunately, it's hopeless because the fracture line underneath. So it's hard to save it. So I was thinking, which doctor I send it to her. I don't want to place it to the wife, but I have to do that. And I remove it very carefully. We cannot break the, especially a buccal bone. So really carefully using a periodontal, and really carefully we remove it. And we've already made a surgical stent. But this surgical stent we can use not only surgical stent but also temporary crown. Now, like a Maryland bridge, And we place an implant, ideal position, 3 millimeter below from the gingival margin. And also, always, Dr. Khan, Loma Linda doctor said, if there is a good, enough thickness of the tissue, long-term result is good. So all the time on the front case, I take some connective tissue from the parotid or tuberosity. And this is the final restoration on the left side crown. And the crown, then a technician make it. But see the line, it was a recession already. If we didn't do any soft tissue graft or like a bone grafting into the socket, then maybe more recession and her tooth is going to be very longer. So I did it from number 1, tooth extraction, and simultaneously implant placement on a little more palatally, and there's a jumping distance. We graft it, and also take some soft tissue, and put the provisional crown, a temporary crown. So we did it only same day from number 1 to number 4. And once we got a stability, then we switch to final crown. But for me, the important thing is make a good customized abutment. So we make it like titanium based zirconia abutment. See the form, almost like soft tissue, wants to stick in with zirconia abutment. So get it stable. So already after 4 or 5 years, still good. The X-ray shows very stable around the neck, and the abutment is good, crown is good. So what I did was, as I explained it, the positive bone volume, I put the vials between buccal plate and the implant surface, because I placed the implant for ideal position, which is more palatally. So automatically there is a space on the surface between the buccal plate and the surface of the implant. As I mentioned, connective tissue graft obviously, and customized zirconia abutment, and make a good crown. I think positive bone volume is really important before we start dental implant surgery. So this is one of the hard parts to create the hard tissue, which is bone. So this patient missing first molar, actually I extracted because she was referred from endodontist, got a root fracture. But she was busy, so she couldn't come to my office. So after 1 year, I think, she came to me, but already, bone has resolved. So we did so many things. But to make a bone is easy. Just, add some particle filler material or something. But to get the good, quality, we definitely need attachment bone. So I will explain later. I'm always mixing attachment bone with vials. And see the quality of the bone. Looks very hard. Sorry, my this pointer is broken. Sorry about that. Yeah, sorry about that. So the bone quality has to be type 2 or 3.